Hey, podcast listeners. Welcome to See You Now. I'm Shauna Butler. 2021 ushered in a whole lot of excitement about the COVID-19 vaccines being authorized for use, and lots of really good questions about these remarkable vaccines, and millions of people being vaccinated throughout the world, improvement in therapies and treatment of COVID-19. In general, the first months of 2021 and the progress we've experienced provided a sense of getting ahead of this pandemic and a renewed confidence of getting beyond this pandemic. January of 2021 also marked See You Now's first year of production. And to kick off our second year, we explored everything from disaster and vaccines to data and working with faith leaders as key collaborators in health innovation. In each episode, we asked how the pandemic revealed new needs, amplified existing unmet needs, and exacerbated health disparities. And more importantly, what solutions are being developed to address all of it? In listening to the See You Now episodes so far this year, a consistent theme that comes ringing through so loudly is access to care and the many dimensions that encompasses. Is care available? Is it safe? Does it require the internet and an electronic device? Is it conveniently located? What type of transportation is needed? Does it offer services in your language? Is it the care you need? What we've discovered through listening is a massive need to innovate across all dimensions of access and to ensure that we do so with an eye firmly focused on making care and access to it equitable and personalized, and to bring to access and equity the same pandemic-inspired urgency and warp speed response it deserves, and we've demonstrated we are capable of innovating at. On the hot topic of vaccines, we explored the science, innovations, clinical trials, and ethics guiding the record-breaking speed in development of the COVID-19 vaccines and the many important considerations in their authorization, distribution, and administration. And we did so with distinguished experts with decades of experience, expertise, and insights.
It's really important for people to recognize that in vaccine research, we have a really different kind of threshold than we do, for example, in drug research. Safety is absolutely paramount.
My particular passion is ensuring that healthcare workers are properly vaccinated. So I actually help mostly dispel misinformation among healthcare workers.
We've taken essentially a normal biological process and sort of flipped the odds on the incoming attacker and say, okay, we've already seen you before.
When you look at this particular situation where you have a virus that seems to single out people who look like me more so than any other population, and you know that there's something that needs to be done, you sort of have to weigh, well, someone's got to do it, so why not me?
We also took a deep dive on the relationship between health, national security, and disaster preparation and response, and developed an appreciation that while disasters happen due to a myriad of factors and are gaining in frequency, so too are our tools to predict, respond, and recover.
The science regarding climate change is certainly unequivocal, and what that's doing in terms of the increase in some of these devastating natural disasters. We're witnessing increasing social unrest and violence within the United States itself, in addition to the nuclear dangers. The reality is there are a lot of things out there that are hazards. And yet at the same time, the good news is that we are incredibly resilient and very resourceful, and we have brilliant scientists and people working within public health and within the other related arenas to help protect human health. And that's become part of our national security. I'm actually a huge optimist, and I'm challenged to find solutions to help improve the way we do things, and of course, to constantly take the lessons we've learned from all the events that we've been through, whether it was Katrina or Superstorm Sandy or the California wildfires or what happened with the polar vortex in Texas, all within the context of a global pandemic, and say, what lessons are we learning? What do we need to fix? And what can we do better next time around?
We considered access to care in terms of building a more diverse and culturally aware and sensitive healthcare workforce, and discovered a groundbreaking mentorship program that is changing the face of nurse anesthesia.
It was a Black CRNA who was the chief nurse anesthetist. And I was so intrigued by her and the position that she had. Someone that looked like me, I wanted to be just like her. So is the program successful? Yes. But I know that I had somebody else to inspire me to just go ahead and keep doing things that no one else is doing. And that's what I did.
How real-world data reveals bias and disparities in cancer care and an opportunity to do better.
You're a Black woman, you're on Medicaid, you're treated a certain way in certain spaces, no matter what your degree might say. To see that in real time, it's a punch to the gut for me as an oncology nurse. And I can't tell you why, but I can tell you that every clinician struggles a bit with bias in their day-to-day care. We can talk about this anecdotally all day long, but the data is in black and white, and it gives you something to react to. It gives us something to talk about. How could we harness those things to actually look into disparities in cancer care with some gusto?
How staying fully engaged, fully human, and listening to the fine details is critically important to fine-tuning an innovation for its intended impact.
When we provided medically tailored meals, it made a difference. And we thought, whoa, we're on to something now. So we say, okay, well, we're going to do it for all pregnant women. We were doing that outreach, and when we called and asked some of the moms, what you thought about the food, they were like, I didn't have any. So, okay, we had to take a breath. What does that mean? You didn't have any, They said they gave it to their children.
Oh.
It's not about just pushing one button. You've got to really follow the whole story and make sure your intended impact is going to happen. And so it's that level of humanness, listening, and acting in a way that is consistent with our values that changes things.
And we discovered nurses in New Hampshire and Kentucky who are innovating boldly, creatively, and urgently to build and design access to care that is highly personalized by tapping into, collaborating with, and knocking on the doors of locations that build trust.
I opened these clinics firmly believing that people are not going to be treated as numbers. We're going to know who they are. They're not a sinus infection. They are a person who's there to seek care, giving vaccinations, educating people, knowing their families, and being able to say to them, do you have food for your family? Do you have heat? Are you okay with clothing? Those are questions I ask of my patients every day. When we forget that these are people with lives, we've forgotten the whole reason we opened this clinic. Not to be another access to care, but to be a different model of care.
I do not believe you can have quality without equity in care. It is my goal to continually look for opportunities to make the environment better for people from all backgrounds who are doing the work, so that they can be their very best true selves to provide culturally congruent care to the people that we serve every day. Our path forward and our success is contingent on how we engage the community. We've only touched the tip of the iceberg in innovation.
Throughout the stories in each episode, what we've heard is that the challenges and problems in healthcare are incredibly complex, that they are connected, and in order for solutions to be effective, it requires paying attention to the details and every inch of the last mile of delivery. In addition to access to care, another theme that emerged from these episodes is equity. What does equity mean? What does it look and feel like? How do we achieve it? In these episodes, there is an urgency to making care, vaccines, mentorship, wellness, and access equitable, and to do so in a way that is personal and personalized to the circumstance, the need, and the aspiration. And we've only scratched the surface of the exciting, daring, and inspiring stories of transformation that are happening in healthcare right now. We'll be sharing more enlightening, fun, thoughtful, tender and sensitive, and yet incredibly uplifting conversations in a few weeks. In the meantime, we encourage you to go back through our library, rate and review the shows you love. Please share them with your friends. And also, share your stories with us. We want to hear what problems you are seeing and solving. Email us at hello@seeyounowpodcast.com. We'll be back soon. For See You Now, I'm Shauna Butler. Thanks for listening.